Hi, I am Dr. Yeshwant Mane, Director, Atharva Infertility Center, Nasik. Today we will be discussing what is embryo freezing. Embryo freezing is a technique which involves freezing of the embryos at very high degree of temperature, that is at minus 196 degrees. In IVF cycle, embryo freezing is a very important part of treatment. At Atharva Infertility Center, we do freezing on either day 3 or day 5 of the embryonic stage. The advantages of freezing is the frozen embryos can be used at a later date. Suppose some patients they have multiple embryos which are developed and all of them are good quality. So you can freeze 1 or 2 embryos on a cryolog, and if there are multiple, you can freeze those extra embryos on multiple cryologs and freeze them at minus 196 degrees. Once frozen, these embryos can be reused anytime for the next 10 to 15 years. In the subsequent cycle, if the patient is scheduled for an embryo transfer and she conceives, that's the great news. And the rest of the embryos can be stored in the liquid nitrogen container for at least 10 to 15 years. Suppose this patient conceives in the first attempt, and 3 years or 5 years down the line, if she wishes to have a second issue, then she need not undergo the whole IVF procedure again. So she can get pregnant with whatever the extra embryos which were frozen in an initial cycle, and she can get pregnant with her own embryos. This is the positive aspect. If you compare the negative aspect, IVF is unfortunately not successful in 100% of the cases. In 30% of the cases, IVF treatment fails. Majority of the cases, the cause of failure is not known. In very rare cases, we can pinpoint the cause of failure. It could be a bad embryo quality, it could be a bad endometrium, it could be poor endometrial blood flow, or it could be a difficult embryo transfer. But in majority of the cases, the cause of failure cannot be ascertained. Suppose a patient doesn't conceive in the first attempt, and if the patient is having her frozen embryos at the clinic, in the subsequent month again she can try with her own frozen embryos, and there is equally good chance that she could conceive in this frozen embryo transfer cycle.